to meet you.
Are we expecting anybody else?
No, Dr. Bragg can't make it. so-
Okay. And
Okay.
the lawyer?
Oh, he's coming, he's late.
Okay. We can go ahead.
He's coming though, I know he is.
Okay.
First thing he said this morning,
Okay.
reminded
Well, I see
me.
a packet over there. So, okay, well, welcome to the regular, well, it's not a regular meeting. It is a regular meeting, but it's the January one, so, you know, but we'll call it the January one held in February. So, okay, so call the meeting to order. We have a new member, Dr. Hoeksema.
You got it.
Did I get it? Yes.
Thank
And
you.
you're with Family Practice, Marion
So
Family
with
Practice?
Marion Health.
Marion Health, okay.
Very good.
As a, you want to just give a brief bio, please?
Sure. I'm the clinical psychologist with Marion Health, and so I'm seeing patients for, mainly for psychological testing, clarifying their diagnosis, working a lot with substance use, alcohol use, patients in crisis. So we're working hand in hand with our doctors, doing consultation.
Okay, perfect. Okay, great. Oh, we'll line up afterwards to get help, okay? So, approval of minutes from November 13th. Seems like a bit ago. But I did read, I mean, I've read through them and all, and I didn't see anything jump out that looked,
I'll make a motion to approve.
okay. Any questions or comments? Is there a second?
Second.
Okay. All in favor of approving the minutes from November 13th, say aye.
Aye.
Opposed, same sign. Abstentions? Okay, so, Tara, we're going to turn to you for election of officers. Well, what all officers are we?
Just president and vice.
President and vice. Dr. Hoeksema, what would you like to do?
Baptism by fire.
What role would you like to have here?
Why don't you tell me? What? I was not anticipating that question.
I'm going to ask everybody what role they would.
Okay, could I answer last?
Yeah, you can.
Thank you.
ask. Okay.
I am so unprepared.
Well, yes, like so am I, really.
So let me, if I'm understanding this correctly, we need to do another, this is our new year, so we
Right.
basically are doing
Yes.
our president and our vice
Right,
again.
uh-huh.
And
And
current-
all positions are open,
and-
president and vice president.
We
So,
just redo them every year. So
right,
yes.
yeah. So
And
the-
currently, you are president
I am.
and Denise is
And I am vice president.
Yes.
I'm perfectly okay with that
And I
arrangement.
begged off last year because of some overwhelming responsibilities outside of this, but things are better.
Okay.
So, I would. Being as I punted last year and that wasn't really nice.
Okay, I would make a motion for Denise to be the president this coming year.
And who would love to be the vice president, because really the only job you have is to fill in for the president. If the president can't be present, it's a lot of peas in one sentence, but, so it's not a big responsibility job. And really, the president is primarily,
Tara
In
does a lot
charge
of
of-
work for us.
yes,
Yeah.
She does.
presiding over this
Yes,
meeting.
Yes, yeah, and then, yeah,
Yes.
okay. Would you like a position?
I'm here to serve however the committee sees fit, so.
I
The
think
city
you have
committee.
all the qualifications to be a good vice
Can we
president.
get, can we get a second on the first motion? That
We did, I thought we had a second.
Did somebody
I
second?
No,
thought-
I don't even think we had a motion, did we?
Yes, I'm
She's making a
I'm making a motion.
Okay.
Yes, that Denise would be the president.
The motion, can we get a second?
Second.
Okay,
Okay,
thank you.
well, let's just vote on that now so we clarify that. Yeah, I was gonna do both at the same time, but okay, all in favor say aye.
Aye.
Abstained? noes and abstentions. None permitted. Okay, now we'll move on to vice president.
Yes.
Right.
Can I move that Sarah Seward be nominated as vice president for 2024?
I'll second that one.
Okay. Oh, okay, any discussion? All in favor of Sarah being vice president, say aye.
Aye.
Same sign for no, or abstentions, okay, perfect. Denise and Sarah. I have to say, this was wonderful. Because in the past, absolutely no one wanted to do this at all. And actually to have willing people is quite nice. So, do you want us to switch places then?
That's up to you. Your nameplates are gonna be.
Would you like to?
I don't care. I can
We-
preside
we
just
can-
as
okay.
well from
You
here as I
preside over there.
can from
Okay,
there.
perfect.
Okay, so with item number 3 off the table, we will take our division reports for review. Does look like it was a very busy season for environmental doing housing complaints. Whew.
Yeah, I did have a question about that. There were 18 housing complaints for that, but then there were 72 rechecks on housing
Yes,
complaints.
some of them are multiple times we have to go out.
Okay,
And then we did have some houses that were posted previous years that we go out occasionally and check to make sure.
okay.
And we did find a couple of those that the houses were tore down, so we was able to close them cases.
One way to close it. Okay,
Yeah, yeah.
that was my only question.
Okay. Okay.
Can I ask a question about the animal bites?
Yes.
So the investigation, they want you to go out
No,
and
it's,
find out who the animal it was, or I
no,
mean,
it's telephonic. We have to call the
Okay.
individuals
Okay.
with the reports that we get from
Okay.
the hospital. And then just do an investigation.
yeah, okay,
This is actually an agenda item that we're gonna talk about.
good,
Yeah.
because I'm like, what?
Yeah, it is kind of blossomed into more than it used to be.
Yeah, because that's putting a lot more, yeah. It's kind of like the lead thing too, though. The lead put a lot on the environmentalists that you're just supposed to magically know.
Right, right.
Without a lot of direction, you know, the lead program there for a while was kind of crazy. I think they fixed that a little bit
No,
now.
it's booming. again.
It's still
Jeff's
crazy.
ready to go get
It's still crazy too.
Because they lowered the number of every.
Yes, yes, I knew that, because it used to be quite a high number, and then over my course of time, it substantially went down, and then I had heard that it had went down again, so.
Well, and Jane said that they've just talked about lowering it again, so we'll see what comes from that, but.
I have a comment too on the animal bite thing. What? That seems more of a nursing division duty than it should be environmental. How did it get assigned to environmental?
Well, it's been like that ever since I've been here.
Okay, so it just,
Promote,
yeah,
generate disease,
Yeah.
this-
Yeah.
evolution of the system in an irrational way. Okay, okay. So hopefully there's a solution to that we will discuss later, or,
Something to make it easier.
okay,
We hope. We hope.
okay.
Yeah.
Do you have appointments for the COVID as well? Or can you make an appointment, or do you just take walk-in?
Both.
Okay. Thank you.
Do you just need a motion to approve the reports? I'll make a motion to approve the reports.
Do we have a second?
Second.
Okay. Any discussion? All in favor?
Aye.
Opposed? Approved.
Yeah, I'm going to save most of my words for when we talk about the HFI funds. I've continued to be getting to know the staff that we are working with here, and I just wanted to say how impressed I am by all the people that are employed by the Grant County Health Department. They work hard. They sometimes find themselves in very precarious situations with angry citizens because they're doing their job. And I just wanted to affirm the work they're doing, and it's an incredible group of people. So I'll talk more when we come to HFA funds.
Okay. Moving on to old business. Comments on the on-site septic ordinance, so one more time. Not the one, just one more time, and then one more time. Okay.
All right, so we found recently that we have more paperwork to do for the state before we can send this on. So we was gonna see if we could table it for one more session. Some of what we're doing here, couple of things that's changed in here. The soil pit, we had to define that and why we need that or why we don't need it.
Okay, all right, I'll quit looking.
But I'm just kind of touching on a couple things that's changed in it.
So it's the soil?
Yeah, basically what you'd need a pit for is if you got an immense amount of clay. And if the water's not gonna move through it, they got what they call moraine soils, shrink swell clays. When the water hits it, it swells up, seals off. And you don't wanna put a septic system in there. And really, the only way you can see that is with a pit. So, that's where an installer will go out and dig 2 or 3 pits for the soil scientist, and then they'll describe it and see if they have that kind of soil. So that's one thing. And then on the installer registration thing, we're doing away with the bond because they said that the TRP absolutely will not accept that. That
TRP?
technical review panel.
So maybe they need a little background. Go back to when they voted the current ordinance.
Okay, yep, I can do that. So back on July 1st, I believe it was, the legislation kind of came down and made all 92 states, they're,
County.
yeah, a little bit nervous, but all 92 counties, the ordinances are null and void. So we can't operate off of what we had. So basically what we're doing is working off of the state rule. And we can't be any more stringent or we can't be less stringent. So we got to be 100% with that. So we've been working on getting a new ordinance in order. We've had a couple of them and sent it to Alice at the state, and she said they won't accept that.
And Alice is on the review panel. So the
Yeah.
TRP is a technical review panel who has to approve our ordinance before we can enact it. Anything different from state rule, we have to justify for them to consider approving it. Does that sound good?
Yeah,
Like the
Yep.
soil pits, we're known
Yeah.
to have a lot of clay in
Right.
Grant County. Therefore, that would be a reason for them to possibly accept that additional,
Right. And then we have to explain in a different form why.
right.
And then if there's gonna be a cost difference and stuff like that, so,
For every change from the rural to.
yeah, so
Do
that's
they
what,
also set the fees? The
No.
state?
no,
Okay.
they're not gonna do anything with the fee ordinance, so we're safe on that. But, the ordinance, we have to abide by with.
I think what the state is trying to do is make sure that the additional items that each individual counties ask for is not financially
Impacting,
huge, you know what I mean?
Right.
Like an enormous cost that is ridiculous. You know, they're trying to, you know, be mindful of the people's pockets as well.
So, well, it'll be much easier to write it and approve it if it's gotta be the state's.
Yes
Yeah.
and
in
no.
many-
Yes and no.
In many ways, for the most part.
We have
it-
taken the state rule, yes, and we'll do some stuff with the
Mhm.
soils. There's a couple other small things that we're asking for that are different.
right,
But, I
right,
mean, that kind of does away with 4 years of trying to write one.
right, right. So, yeah, we're still working on that. I mean, we're pretty close from what Alice said. So I just need to get those other documents, done up, and then we should be able to submit that.
It's challenging because we have to get the health board to approve it and then the commissioners to approve it and then submit it to the TRP. And if the TRP rejects it, then we have to start back here and do the whole thing over. So we're trying
Right.
to get it right.
Get it right the first time.
Right,
Well, wasn't it about 2016 they changed the state code on the approval process? I worked at the state health department at that time with Alice, and we did like a lean
Sounds about
improvement
right.
process because it goes into an automatic approval at the state. If they don't get it reviewed and back to the county, then the county has an automatic green light, and so there were concerns related to approval process back then. So I know they've done a lot of work with that, so that's probably why they've changed the ordinance across to where it's more in line with the state. So each county is doing something similar to expedite that approval process at the state level when they receive those plans.
Right.
Because they were having challenges to be compliant with Indiana code on that piece of it at the state level several years ago when I worked
Right.
there. So I'm sure that that's not necessarily improved over time,
Uh,
as it's hard to
not-
retain people
right,
in that
Right.
process. So-
And a lot of people retired in the last decade.
Yeah, so I'm,
Oh,
I
yeah.
mean, when you have a similar ordinance and basically
It can be
rules that you're trying to
automated.
follow, it will hopefully improve your
And
approval
it's easier for
rate
Right.
installers
process
to
at the
work.
state
Cross
level.
county.
Yeah, it's
Right.
easier for the installers to work cross-county when you don't have such a huge change in the rule from one place to another.
Correct, yeah.
yeah, and there really was, I mean, from one county to the next, I mean, there was a big change, and I think that's what legislation was doing, is trying to level the playing field. Makes it extremely difficult for us, because, you know, we do have people coming out of the woodwork wanting to be an installer, and we gotta allow them to, right
It's
now.
great we have Alice, though, I mean, as a connection to help
Yeah.
Right.
kind of have a
Very
preview.
helpful
That's very
Right.
beneficial for our community.
So, that's about all I got on the septic for right now.
Thank you.
So, yep,
Thank you. And the tattoo body piercing ordinance, which we do have paper on.
Cassie is gracious to be here tonight. She's been in the hospital. She's awaiting surgery and she's not feeling well. So that's just an example of the dedication of our people. So thank you for being here to present this tonight.
Well, she did a tremendous amount of legwork on this as well. Okay.
Oh, boy. I don't even know where to start. This is new for me.
So we have one, right, this one here, the old one.
You should have the proposed one.
And we looked at a draft of this at your first meeting.
Yes.
We looked at a draft of it, yeah.
Yes.
Yeah.
And I don't think we changed much since that. Do you want to sit down, Cassie?
I'm okay.
So just kind of explain why you felt the need, why it was decided that we needed
I was looking at the older one and didn't really go into detail a lot. We didn't really have a lot to be able to fight with. A few examples is we get complaints about people doing tattoos or piercings in home. And there's nothing really in there that we could do to stop them. We added it into the new one about doing a cease and desist letter if they get caught. And then after that, there's more processes to it. To help stop some of that, because there's quite a few of them that do it at home and it's unsanitary.
That's against the state code also. So,
I ain't looked at this. It, not,
not very vaguely, I think.
yeah, not vaguely. We put in there like the documentation that they would need if they are tattooing or piercing on a minor, at least 2 forms. Because, excuse me, a lot of step-parents or aunts or uncles will go and take somebody to go get one. Well, then you've got parents getting mad, it's not their legal guardian, and so consent forms and birth certificates, stuff proving that they're their legal guardian or parent is needed. And it covers the tattoo artist as well. That way they're not in legal trouble. What else? Sorry.
So how does this model with the states?
She took a lot of it from the state code. She also went to different county ordinances and kind of see where they're at. And then we took bits and pieces from all of it.
Interestingly, several of our tattoo ordinances or artists and establishments are for this. They're
I had spoke with some of them about kind of what I was doing, maybe got some of their opinions as to what they thought. I kind of put a little bit in there. Because I'd rather them be for it than against it. Tattooing and body piercing has changed so much over the years. Between dermals, which is like in skin, they stay in, they don't come out unless you have to have them surgically removed. Certain instruments they use are different, cleaning instruments, sterilization, all that has changed, so I wanted to cover a lot of it in there.
Yeah, a lot's changed.
Yeah.
It just provides greater clarity than the old one that we've been working under in many, many areas. And they just didn't do it.
Tara, I just noticed, I did not realize, I guess I should realize we had a prior one, but I did. Does it say, I can't remember it here, normally it's in the whereas clause that this will replace existing ordinance number blah, 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 2012-01. Let's add that. Long passage, something along those lines. Once this ordinance is passed, it will replace 2012.
It does, repealer, section
In the
Y, the
back.
provisions of Grant County Tattoo and Body Piercing Ordinance 2012-001 are hereby suspended by this ordinance.
Oh, yeah.
Yeah,
It's in there.
section Y repealer, yep.
Would you rather leave that up to anywhere else?
Yeah, I put it towards the top. I should have caught that before, I did review it, but I missed it.
Can we pass it anyway with that, or do we need to bring it to the next?
Say that again.
Can we pass it with that change, like just say with that change
With
it's
an
passed, or
amendment.
do I need to fix it and bring it to the next meeting?
No, they can approve it.
Okay,
They
okay.
can just,
Because the content is there.
that's, yeah,
Right.
I think location is,
just moving it.
Okay.
And I always like the whereas, and then now therefore be ordained, be in capitals and bold too,
Oh. Okay, whereas, okay,
and bold type.
and now therefore be it ordained,
Now therefore be it ordained in caps and bold.
okay.
So they can still do it out of their home? Is that-
No.
No.
Okay.
This just, in here, it gives us more, like, if we do get a complaint, we can go out and, I mean, we can't go out and take their things,
Right.
but at least they'll know that we're on to them, that we know, and we're aware of what they're doing.
Yeah, we'll take a cease and desist letter with us and tell them they need to stop
So,
immediately.
how will you handle, like, what I've seen is these, like, pop-up tattoo parties?
That is a lot of the home things. Those are not allowed because it has to be in a sanitary environment. It cannot be in living quarters, no animals, no, you know.
So would you retrospectively address it? Would you real-time try to address it? I mean, I'm concerned about your safety if you go to one of those parties and be like, time out, you can't do this.
They could actually
Right.
call the police department
Yeah,
to go out with them, and that's usually what we would do.
right, yeah.
Kind of like some of the housing complaints you have to call.
Yeah, depending on the situation, it's nice to have an officer with you,
Yeah, yeah.
in case he gets crazy.
You get a gut feeling, it's usually time to take one with you.
Yeah.
So,
But those are hard to catch because even on
Oh, they're all
Facebook,
over
because it's
social
trying,
media.
yeah, it's like, if you have to be on social media all day, every day, just like following and trying to find it, you know, searching keywords, tattoo party,
It's
right.
all over.
yeah.
Of course, worst comes to worst, we could send it through the mail to the, if there's an address there.
Yes.
So,
I'd make a motion to approve the tattoo and body piercing ordinance with an effective date as recommended, July 1st, 2024, with the one change noted. No formatting.
I'll second that.
Okay, any discussion beyond what we've already done? Okay, all in favor?
Aye.
Opposed? So approved. Okay,
thank you.
Thank you.
you're welcome.
Thank you.
Okay.
I kind of miss those days, 'cause remember we used to be able to ask questions and talk to the staff before, and then I think when around COVID, they quit having the staff come in?
All the staff, it depend on who wants,
Yeah,
who's bringing
yeah.
something.
Right,
Right,
right.
we don't need every single person every single time, but it is nice to be able to ask, like, hey, while you're here. Because Tara, like that, we put a lot on Tara, 'cause we're like, hey, Tara,
Yeah.
can you find out? And she's like, yeah, okay, you know.
Okay, so HFI spending plan.
Yeah, we have a plan.
Inform us.
Yes. And what the good news is this does not have to go back to the commissioners. The money's approved. We have the $100,000. And so we would like to share what we've come up with and how we'd like to allocate those funds that we have. And we have to keep in mind, we're addressing some of the key performance indicators that the state has mandated with how we spend this money. And there are several. We have focused in on the chronic disease prevention, and we are proposing that monies are given for scholarships to facilitate walking programs that are happening through the community, and just a scholarship individual citizens that want to walk, but dropping $5 a month or $1 a day is cost prohibitive. And we've talked with Taylor University, the Invitation to Health Program, the Wellness Center, and the YMCA. Taylor, the Invitation to Health Program is on board, the YMCA is on board. The Wellness Center, they were given the Silver Sneakers Program, and because they're a privately owned entity, they're trying to sort out if this is something that they can do or not with just picking up silver sneakers. We also talked with the state a bit about this thought of scholarshiping our local clinicians for this diabesity course, and the state was.
Can I ask about a question
Yes,
about the walking? One thing that I found, a lot of the health plans for us on Medicare, excuse me, include a wellness program. And when I've talked to people, they have the same one as I do, and they don't even know anything
Right.
about it. So
Right.
that would be another thing to educate people with.
Right.
Is to, you probably have one.
Yeah.
If you're retired.
Yeah.
But
And-
not the non-retired. But Yeah.
And what we looked at with how we allocate these funds is we're not trying to reinvent the wheel or develop a brand-new program because the staff is stretched to the max with all the state required things. So what we're trying to do is come alongside these community partners and help support what they're already doing or trying to do.
Excellent.
So,
Question as well. Will any of this $10,000 be assigned to publicizing these programs, or?
they will do that themselves because they would have this program and they would be talking to the people that are in their encatchment that they're trying to reach and tell them this money's there.
Okay.
As far as promotion, that's kind of our final thing that's on the list here that we have talked about. The chronic disease prevention, I had talked in November about this diabesity program, which is an online 8 hours of continuing medical education for nurse practitioners and physicians concerning this concept of diabesity, which is the continuum of obesity and diabetes, which are core things we have to address. The state loved the idea. The state health officer, what's his, it's not the commissioner, the chief medical officer.
Lindsay Weaver.
It was the person under her, but they thought it was an excellent use of these resources because our clinicians will be engaging with these people all the time. This is going to better equip them to do their job. And we've developed memorandums of understanding so that the clinician will understand that when they complete this course, they send us a certificate of the completion that's given by the program, and then we will follow up with them in 4 to 6 months to see how this is changing their clinical care of the patients. We also are doing the same thing regarding the maternal mental health issue, and that's Dr. Pearson with that course that you proposed.
Excellent.
And we would provide scholarships. Dr. Hoeksema actually had talked to DCS, and they were interested in some of their clinicians. We would invite Radiant Health, the family birthing. So they would be able to send a couple of their clinicians. This is a little more intensive. It's 16 hours online over 2 days, and it's offered several times throughout the rest of the year. But we want to try to spread this out so that a lot of different points of contact are given these opportunities.
It's exciting.
Yeah, the same thing with the chronic disease prevention. I've talked to, I have a list of Marion Health providers, Indiana Health Center providers, and we met with Bridges, and they have. And I'm going to have to show up at the door of Optum Health, I think, like a salesperson, to talk to their staff, because I just don't have a way to call without going through the receptionist and everything, so. Then chronic disease prevention, we are wanting to collaborate with Purdue Extension. They have wonderful evidence-based education. And they have a lot of community partners, like the low-income housing units have kitchens, they have rooms, and they can just take their program out throughout the community. But one of the problems they found was the Dining with Diabetes course, which is over 4 weeks, where they're actually cooking foods and meeting and addressing diabetes. $40 was a deal breaker for many people in our communities. And so by us scholarshiping those people, they can go into our different housing units and help educate people with diabetes how they can cook resourcefully.
Do you feel like there are enough places in Marion to hold these classes?
Well, I think there's enough places, and the Purdue Outreach representative we met with has tons of people that she works. She has all kinds of resources and locations that she mentioned. But if I know you've talked about some churches that have places. She's willing to go anywhere that will take her.
Okay.
Yeah.
And which one of the extension educators is your?
Yeah, I just blinked, yeah. I know.
If I had my phone, I could look at it, because I have
Yeah.
all the contacts for all the extension educators in my phone, but,
Yeah.
this is really, really exciting
Yeah.
thing, yeah.
So we would be
And
addressing,
Thriving Grant County would be would they go to Thriving Grant County because they do a cooking thing?
She will go anywhere that will take.
Yeah.
yeah. And once she knows she has the money and she can go offer her services in their facilities, she foresees no problem with having places to go, and she has capacity to do 2 or 3 of these a week. Yeah.
Which is awesome.
So-
100% guarantee you that my church will join up with this, because it's something that we've talked about
Yeah.
at length, and we have a huge commercial kitchen and
Yeah.
are centrally located and have parking and all the things, so.
And we also learned Marion Health has a
Yeah.
checkout kitchen that you can take anywhere.
Oh, wow,
So,
okay.
that even places that don't have a kitchen, we
Yeah.
have the resources, or the Purdue Extension can check, and she already uses it. Tara and I just didn't know it, but that kitchen can go anywhere.
That's
So
really
we're super excited about that. And then finally, or next to last, the harm reduction. We just met with Bridges to Health, and they are working on this Core Plus program. They had been told they had a grant from the Indiana Department of Health, and to spend the money now, because you have to have it spent. And not very long ago, they got a letter telling them to cease and desist any spending of this, because the Indiana Department of Health and the CDC were somehow in conflict about this. This has gone to our local representative, Lori Reeves, and the legislature who approved these monies had no idea that this had happened. But right now, they have a new employee that they've hired, and she's the only female on their team. And they could utilize the money to help keep her employed. They're pulling it from other things so that they can keep her as a core, not volunteer, a core team member. And so we would like to give Bridges $50,000 to continue to support the Core Plus program, along with, they have some initiatives for primary prevention to start working with kids to keep them from needing the Core Plus peers that are working with people that are already entrenched in addiction.
Is there any chance that if the two conflicting parties can resolve things, that those monies will become available again? Or
I don't
who
know,
knows?
and has to
How
go
much
through
is-
multiple
How much
layers
is
of.
at risk here, or been sequestered?
They had been told they had $250,000. This is huge. You know, our 50,000 is bare bones.
And Bridges to Health is only one of multiple in the state.
Yes, this is statewide.
It's a statewide disaster.
Yeah.
And some of the monies were spent and they're not getting,
Yeah.
it's bad.
It's, yeah.
So I'm learning how to work a little bit within the government system, but not well. But I think we just have the power to make something happen. And so let's use the money we've been given, the commissioners have approved it, and let them continue to move forward with what they are hoping for. And then finally, we need to spend a little bit of our money on just trying to promote what the health department actually does. Nobody amongst us is skilled at social media promotion and all the other ways, so we would like to use some of the money just to get the public has no idea what the health department can do. You know, the vaccine programs, you know, we offer some that the only place you can get them is here or at a pharmacy, and it's so easy to just park and walk in and get a vaccine. We'd like to make those known, so some, what would be marketing dollars.
I don't know if anybody on this board has ever been contacted by any of the local radio stations, but they are very willing. Ed Breen and
Well, not Tim George anymore. maybe.
Is he gone?
Is Ed on now? Is
Well, he
gone?
had-
But
was
they
very,
used to
very
do a morning show that was very community-based, and they, you know, I've been on the radio multiple times with them, talking about, you know, pet care issues and things like that, but, and it's free. I mean, they're
Right,
doing
yeah.
it as a
Mhm.
community
Yeah.
service, so
Mhm.
I don't know if it's been a couple years since I've talked to them or, you know, done anything with them, but I think that would
Yeah.
be a really inexpensive way
Yes.
to get the word out.
Yeah.
Is it like Tuesday mornings?
Well,
I think
it's
it was like
it's every-
Tuesday mornings.
I don't know what day the health department had. 'cause-
Pre-COVID, the health department did those all the time. It was a monthly
Yeah.
meeting, and Dale loved them.
Yeah.
I don't know why it fell off the grid. I don't know
Well-
if they quit asking or if we started saying that.
I don't know, Tim George got really sick. That whole
Oh,
thing kind
Tim,
of got,
thank you.
yeah.
Could not think of his
kind
name
of
to save my life.
Probably stopped some things that were
Yeah.
going on, but
Mhm.
I haven't listened to him recently, but
Yeah.
yes.
So that is what we would like to propose, is
Mhm.
what we are hoping to do with these monies that the state has entrusted to us.
Does Marion Health, the family practice part of it, do they recommend their people to come here to get vaccines for the children and stuff?
I have since I started working here. Before that, I didn't. I didn't know what was done down here, and if we didn't offer the vaccine, I would tell my patients, you can get it done at the drugstore. But I didn't know, and so I've been spreading the word amongst my peers that this is an option.
And I don't even know what all ones are given now.
Yeah, the childhood vaccines, I think, is pretty consistent across, except we do have the RSV vaccine, which I don't think is elsewhere in the community. I don't think it's being given for children through Marion Health. We also have the RSV for adults, and that's not in the offices, and the COVID vaccine, which is not in the offices. So, and it's just so easy to walk in, you know, park on the street and walk in.
Some pharmacies are doing the RSV now, I guess.
Yeah, they are for adults, but not for children.
Not for kids, yeah.
Yeah, and the kids is so important, but manufacturing issues have made it scarce.
Yeah.
So that's what I'd like to propose.
We don't need do we need to approve it?
Well,
or-
I don't think so,
Yeah.
but certainly we want feedback and your blessing.
I think this is, at least in my mind, exactly how I hoped we would use these monies. Because for all the reasons you've already said, we can work better partnering with existing services. I think the real challenge here is just the communication piece, the advertising piece, letting people know these things are available and getting them to use them.
I'll make a motion that we vote, that we support this,
Yeah.
that what has been described has been excellent.
On the advertising piece, just because I've learned so much as I've been in charge of public relations and marketing for Marion Health for the last year and a half.
Yeah.
There are opportunities in the community with our colleges for student interns, like if you wanted a student to assist you from one of the universities, they're all the time looking for internship
Oh, that's good to
opportunities.
know.
So that might be a
Yeah.
reduced way to maybe
Yeah.
pay them a little stipend.
Uh-huh.
They
Or
love
there
doing
are-
social media campaigns. They really do.
Or there are lots of companies that you can partner with that will target specific populations
Okay,
based upon AI data that they can retrieve. It's kind of scary.
yeah.
But they can tell you their demographic, their age, places they frequently visit, those kinds of things. Like if you want to do paid advertising and sponsorships, I'd be happy to kind of help connect you if you
Okay.
don't know where to begin.
Okay,
Just reach out to me and I'll help you kind of get started with some of that. Because when you don't know, it's
Yeah.
kind of, you're shooting in the dark.
Yeah.
But there
And
are a lot of places out there.
the state has actually just, has hired a person
Oh, good.
to help all the counties with this, but this is brand new. This role was filled by the state, so we do have a resource within the state, the Indiana Department of Health, to help us to use that. And we're not talking much money, we just wanted to say that some of the money would help with our marketing process.
I second your motion.
Okay.
Oh, sorry, okay. All in favor?
Aye.
Aye. Opposed? Of course not. Okay, we give our
Thank you so
wholehearted
much.
endorsement.
Really appreciate it.
I do
Thank you.
have one other question too, though. In regards to the funding through, or the classes through Purdue Extension, I mean, this is just a very short list
Oh,
of
yeah.
what they offer, so could these funds be applied to any
Yeah.
other courses?
Yeah,
that
we
are-
have to stick with our key performance indicators,
Mhm.
but she gave us like a 4-page document
Yeah,
of
yeah.
courses. So, yeah, with your permission, we might, once we've saturated the Dining with Diabetes and Be Heart Smart class, we can expand that.
And,
We'd love to.
Yeah.
Yeah.
There are lots of wellness-related things in their program, so. Okay, awesome. Awesome. Okay, moving on to new business and our animal bite investigations. One more time.
All right. So, basically, ever since I've been here, we get those reports, and then we would put it into the state database, and then they would do the investigations on it. Here recently, what would you say, about November, they kept building up into the system, and nobody was investigating. And the nurses came to us and wanted to know what was going on, and we didn't know. So we found out that the state actually has a assistance program that we was on, and somehow we got off of it. And so now we're having to do the investigations ourselves. It is kind of time consuming, and with those there, I just picked 3 of them. You can see that they're very vague, very little information. So we got to do some due diligence and contact the hospital, which then we have to send a information request to the patient, excuse me, I lost my,
To give permission
yes,
for them to release it to you?
yes, patient records, that's what I was thinking. Which that takes some time to get that back. So, but that's what we're working with. I did get on a email stream that they're supposed to be emailing at the 1st of the March, somewhere in that time frame, to get back onto that assistance.
Okay.
So this is a temporary situation
Yes.
for you
We're
until
hoping.
we can get.
We're hoping.
But, and maybe there's someone on this board that can help, part of the concern is that these animal bite reports that are filled out in the emergency room are not filled out well. They are handed to the patient or victim, and look at you shake your head, and they're told to do it, and nobody's checking to make sure any information is being collected.
Yeah.
So we're hoping somebody can tell us who to talk to about this.
Right, but part of it probably is, like, if I'm walking down the street and a dog bites me, I don't even know who the dog belongs to or anything else.
They're not even getting contact information for the patient.
Oh, for the patient.
Yeah,
Right.
that's the
Right.
biggest
That's the
thing.
critical thing,
We
yeah.
want to keep an eye on the patient to make sure that they don't come up with any
Rabies.
issues later.
Right.
And a lot of times, it's actually, most of the time, they know who the dog belongs to, but they don't want to tell you. Because they don't want to get anybody in trouble. or-
Right.
Or, it's their mom's crazy little chihuahua, and they don't,
Is this electronic or paper?
We get it by fax.
Yeah, they fax it to
So
us.
Yeah, when I've
the
had
person has to fill it in on a piece of paper.
They fill it out at the emergency room,
Okay.
yes.
That's part of the problem, is
Yeah.
that it's not electronic, that it's easy to move on and
And
stuff.
I think there is a form online, but I don't know how easily accessible. You know how you go to search something and 15 million things pull up that you don't want?
It
So-
must be a triplicate form because it says a white,
Yeah,
yellow, and pink copy.
in person it is, yeah.
Wow.
I can follow up with our ER staff and just,
And we've-
reinforce the importance.
Over the years, we've reined this in a little bit, and I think it's just turnover in ERs as
Yeah.
well that creates.
well, and it's just
Another thing.
the busyness in our ER right now. It's,
And one more added paper is just rough.
I would imagine too, you'd have patients with literacy issues and they would need extra assistance filling this out, would be my guess.
Yeah, because the patients are actually the ones that are supposed to fill it out.
And not the patient, not the hospital staff.
Yeah, not the provider, the
Right.
actual patient.
And does the hospital have these on hand?
I don't know that
It's
that's.
supposed to be the nurse.
Yeah, it's supposed to be, I mean, the reporting agency.
It's supposed to be them filling it out, as they ask the questions to the patient, and then
Yeah, and that's straight from the state, because we had a.
So they
little
have the
consult-
papers on hand down there to fill out?
They should, yes.
That'd be another question I would ask.
And you can access these online and print them off
But
too.
not if
and when
it's
I'm
white,
the one doing
canary,
it, that's what
and
we
pink.
do. No. I mean, yeah, oh no, it's not
Yeah.
the white canary and
So
pink,
you're
but
saying
no.
law indicates the professionals are to fill out the forms.
That's what we had like an educational thing with the state. They came up and showed us how to do this. And they said that the nurses are supposed to do it.
Right,
Am I
but when they
correct in-
say nurse, who do they mean? Do they mean a professional RN, or do you mean a QM, somebody who is a nurse's aide, or some student nurse down there? I mean, that's also part of the problem. I mean,
Right,
the
right.
professional nurse has very little time for maybe filling all of this
Right.
stuff out. But the student nurse who's working down there, or a tech who's, maybe they're called techs down there. So,
I think it falls on wherever the treatment's being given, it falls on them to make sure the report is filled out.
right, so it's not necessarily a nurse, but somebody who has to ask these questions.
Yeah.
so I'll follow up with our ER and our urgent care, because I would guess those people are presenting at both locations.
Yeah, we get some from the VA, from MGH Express, it varies. Yeah, so, and I do want to commend Beverly Penrod. She came, had like, 21 of them backed up. She helped us immensely get those caught up.
Yeah, she kind
So-
of discovered the whole thing
Right.
and asked some questions and then helped get it rectified.
Are these all, most animals, it's mostly dogs, right? It's not raccoons and gerbils and cattle and,
Oh, yeah.
It's
No,
a variety.
Yeah.
We actually,
Horses, you name
we
it.
had squirrel monkeys.
we actually had a squirrel monkey that happened in Mexico. But since they resided in Grant County, we had to do the follow-up on it.
you
And
had
they
to
did
find the monkey to
No,
test?
no. Basically, what happened, the patient, they was on a cruise
Oh,
and got off, and they had a squirrel monkey there, and evidently it climbed up on her and bit her, and then took off. So that was kind of interesting,
I bet.
but yeah, we've had rats, I think a raccoon, we had a donkey one year,
Yeah.
pig, bats,
Squirrels and chipmunks, yeah.
so it's kind of a mixed bag.
It's fun to read the little report sometime about how it, if you can read it. Not-
It's weird to me they don't have skunk listed on here, because we did have for the first time since, I don't know, almost in my lifetime, we had a case of skunk rabies diagnosed.
That's been recent, correct?
Yeah, recent,
Yeah, I
yeah.
thought I read something about that.
Yeah,
Yeah.
but they don't have skunk, that there is an other specify, okay. Yeah, skunk. So,
I think that's it.
okay.
Have any
Well, thank you.
questions? Any other?
No, but I sure hope that we get back on track with the right follow-up agency and you guys don't get stuck with this.
That's the hope. Once I
Yeah.
receive that email, I'm gonna send it in immediately. Try to get back on that
Yeah.
assistance.
All right, well, thanks for doing what you do.
Well, thank
Every
you.
day, all the time.
Yeah, thank you.
All right. Okey doke. I don't believe we have any members of the public present. So, anything else we need to discuss at this time? I would welcome a motion to adjourn then.
I'll motion to adjourn.
I'll second.
All in favor?
Aye.
Opposed? We are officially adjourned at 5:58 PM,
Next meeting, March 25th.
March 25th.
I don't think I'll be here. Spring break.
So we'll go through, maybe we won't.
Pardon?
You'll be, you'll know that. Like, it's just, now two people won't.
Spring
be
break.
here, so
Oh,
we'll just-
is that spring break?
Mhm.
Some schools.
Oh. It's the beginning, it's Easter. It's after, it's before
It's
Easter.
right before
Right
Easter.
before Easter.
It's
Oh,
the
not
week
not as
before
schools
Easter.
go on.
Easter's in 31st.
Oh.
It's very
Um,
early.
Up at Wabash, they go on, they don't leave until third Friday, yeah. So I didn't even think about spring break.